Alright, before Dr. Noel gets started, let's just run through the basics of what's available to you in your transvenous pacer kit. You will have one 5 French pacer wire that will need to be placed through a 6 French introducer, which is part of your kit. If you use a 9 French cordis catheter or introducer catheter, the lumen will be too large and you will have bleed back. So please use the 6 French introducer that is available to you in the kit. With that, you will have a sterile sheath. That sheath will have a distal locking mechanism for the wire that Dr. Noel will talk about. Within the kit, you will have a separate proximal locking mechanism that will lock to the introducer hub as well as lock your wire in place. Chris will make special note of this in the video. Please pay attention. Within that, you will also have your 2 pacer pins, and those pacer pins will need to be attached to a specific type of pacer cable. Not in the kit is that cable, so you will have to know where to go to get your pin connector. The pin connector that works best with this kit is the Remington pin connector, and Dr. Noel will show you how to insert the pins into that. You can also use the Remington alligator clip to make your connection, but the appropriate fit connector would be most optimal. Those are available to you in the clean supply closet, as well as in the heart cart, in the CCU, and they're available to you in the cath lab. So those are all places you can go to if you can't find them. And then lastly, you will need a pacer box in order to make that connection. Please make sure that your pacer box has batteries. Thank you. Let's get started with Chris.
Hi everyone, it's Chris Noel here with Cooper Critical Care. We're going to go over the TVP insertion with a specific emphasis on placement and how to lock it in place once you've gotten it there. So once we have our TVP cordis or introducer in place, which comes with our kit, at this point we're going to take our TVP wire, we have our pacer pins to help us to hook up to our pacer wires and pacer box. Once we untangle our pacer wire here, what we're going to want to do before we insert it is we want to put on our sheath here to keep everything sterile. What's important to know about this kit is it has both a sheath with 2 different ends, but it also has this cap, which is really important that we put both of these on before we insert our pacing wire. So this cap can actually fit right onto our cordis here. We don't want to yet do this because it's going to allow blood to exit from the cordis. So what we're going to do is first put our sheath onto our pacing wire. We're going to expose here. This is going to be our proximal end here. This is going to be our distal end here. So we're going to put it through. And once we get it through the other side, we're being careful not to touch our balloon. We're going to slide the sheath all the way towards the distal end, near where our pacer wires are. And then at this point, we can actually lock this part down, screw this tight to keep the sheath in place. Note there it locks here. We're going to keep this drawn back for now until we get our pacer in the appropriate position. The next thing we're going to do is take this cap. We're going to place this cap on our pacer wire. So we need to make sure this is unscrewed so that we can fit it through. And once we have it here, now we're ready to put our pacer wire into our cordis. The other thing I'll do at this time, just since I'm sterile and I'm going to be handing this off to a non-sterile assistant, is I'm going to take my pacer pins and put them here in the ends here. So these fit, you can see it's just an extension of what's already in there. You're gonna push these, they're a little bit hard to get in, but you wanna lock them in place. Excuse me, lock them, but they wanna slide all the way in. Notice the black is almost entirely underneath the gray. Sometimes that just takes a little bit of pressure, like so. So once we have this, the next thing we want to do is actually test our balloon to make sure that it's working. For this, we're going to take the special syringe, which only takes up 1 cc of air. You'll notice it's the particular one because you can't pull it back anymore. This is the syringe you want to use to prevent overinflation of that balloon. So we'll keep air in there. We'll attach it here onto our balloon, and next we're going to do is to test our balloon is we're going to inflate it. There we go. Let it passively inflate by releasing our syringe, and now we know that it works and we're ready to insert our TVP. So at this point, what I'm going to do is I'm actually going to hand the pacer wires and the syringe off to a non-sterile assistant. So I'm no longer going to be touching that area. Next, what I'm going to do is take my pacer wire and I'm going to insert it through my cordis to 20 centimeters before I inflate the balloon. Notice the natural curvature. We want that to take that same curvature as we go in to follow the path of the SVC as it goes into the right atrium. So again, we're going to pass it in. Now at this point, once my catheter is in the introducer, now I can place this cap on. Notice it locks in place like so. And again, this is where I can tighten the wire once it's in appropriate position, but right now I'm going to keep it tightened so that I can actually advance my wire where I need to go. We notice that there's markings along the wire. So each mark is going to be 10 centimeters. So this is 10 centimeters, this is 20 centimeters. So as I said before, I'm going to be going in to 20 centimeters with the balloon down. Once I get to 20, I'm going to ask my assistant to please inflate the balloon and then lock it as inflated. I'm doing this just for demonstration purposes. Okay, so now my balloon is up. And at this point, I'd also want them to attach my pacing wires to my pacer box. So here we have our pacer box. We have our pacing wires. And this particular kit only has a ventricular lead, or only a single lead, and we're going to put it into the right ventricle. So on our pacer box, we have V and A. A is for atrium, V is for ventricle. We're going to place it into the V. We're going to turn our pacer box on. And for our purposes, oftentimes when we're doing this in an emergency, it's for a high degree AV block. And so we really just want ventricular pacing, and that's what we can achieve with this. So we're going to go on to VVI. So we can change our mode here. Mode selection. Come down to VVI, enter, and now we're going to be pacing at a rate above what the patient's native rate is. And we're going to use a modest output so that we know we have capture, and then we can adjust from there. So 10, 5, somewhere around there until we can know we have appropriate capture and that's in the appropriate position. Okay, so once we have that, we're going to connect our pacing wires. So again, this is the non-sterile assistant. Each of these is labeled as a positive and a positive, so we're going to put positive to positive, negative to negative, and now we're able to deliver pacing via the wire. Okay, so now we are at 20 centimeters. Our balloon has been inflated, stays inflated, and now we're going to continue to advance until we see capture on the monitor. Okay, let's say we now have electrical and also mechanical capture. At this point, I feel happy with my position. I'm getting the appropriate capture of both mechanical and electrical that I want. And now what I want to do is I want to lock the wire in place so that it doesn't migrate from here. So how do I do that? I have my cap on the cordis here. What I'm going to do is tighten this right here. I'm going to tighten it until it doesn't tighten anymore, and that's going to lock it in place. So we know here, if I try to pull on this, the wire is not moving. This is what we want. Once we have this in place, what I'm going to do is now take the still sterile end of my sheath, take care so that I'm not moving my wire, and I'm going to pull the sheath all the way down over that wire, again staying sterile. I'm going to have my assistant kind of feed it to me if I need to. And this just slips right over that lock. So now this entire area is sterile. So in case later on we need to manipulate the position, we can do so in a sterile way. And now we're going to order our x-ray. We want to make sure we deflate our balloon. And now we can adjust our sensitivity as needed on the box to see where we lose capture, and then double our output in order to give us a margin of safety. So if we were here, we had a 5 milliamps is where we are on the monitor now. We have good capture. What we're going to do is watch our monitor. We're going to come down slowly, watching the monitor, and see where we lose capture, where we're no longer pacing. So let's say we have it at 2.5. That's where we lose capture. We regain it at 3. So 3 would be our pacing threshold. This is, we're going to put it to at least 6. Give us a margin of safety here. Now we'll lock it in place. We'll order our x-ray, and we're done. So one key thing for post pacer care is that the tendency is to want to put an infusion through this cordis to keep it quote unquote patent. Well, all of its patency is taken up by this wire. There's no role for any IV fluids through this end of the introducer. So do not put fluids through here. If you do, all it does is back up into your sheath and put them at risk for infection.